Yeah, Jen, the new year came, and with it, a flood of new COVID-19 hospitalizations. To give you some perspective, here at Conway Medical Center, they have had a roughly 5-fold increase in COVID-19 inpatient admissions since before the Christmas holiday. Yet another COVID-19 surge, sending patients to the hospital across Horry County.
Here we are again. Emergency rooms very busy. Our inpatient numbers are going up. Goodness gracious, the percent positivity that we're seeing is the highest we've ever seen.
In the past 2 weeks, Conway Medical Center saw its COVID patient count go from 4 a day to now more than 20. In Georgetown County, just before Christmas, Tidelands Health had roughly 3 patients. That amount is now up tenfold. Hospital officials reporting their intensive care unit and inpatient rooms are well over 100% capacity.
We just don't have enough workforce for an excessive demand that the COVID pandemic has put upon us now, especially with the Omicron variant causing increased transmissibility and really a higher infection rate.
CMC alone reporting a 33% positive rate in COVID tests midweek. Unlike the previous surges where the virus dominated the unvaccinated, Thailand's numbers show last week a significant amount of daily patients were fully vaccinated or boosted.
What we're seeing now is the Omicron variant. It is more contagious, one would say, but the way it seems to do this is it overcomes antibody resistance. It overcomes the immune response.
Dr. Gerald Harmon saying while they are seeing the virus impact the inoculated, those with a booster appear to have strong protection against the latest case spike.
Please decrease the stress by getting your vaccines. That's the absolute best thing we can do right now.
Now, there's also concern for emergency rooms right now. The latest DHEC data shows that folks coming into ERs questioning COVID-19 symptoms, if they are positive or not, that is flooding emergency rooms to the highest they have ever recorded since going back to late 2020. And Dr. Richardson here at CMC, he also brought up to me the concern about influenza. They're seeing an uptick in flu cases here, and that's also adding to the stress on medical providers.
Yeah, Jen, at tonight's school board meeting, the board reviewed current coronavirus cases between students and staff, along with DHEC updates on quarantine guidelines. Horry County Schools Superintendent Dr. Rick Maxey says in December 2021, staff and students were seeing a decline in positive COVID cases. But as students are coming back to school,
we are very much like the rest of the state and the nation in experiencing a larger number of positive cases of COVID-19. Largely due to the Omicron variant.
And along with a rise in positive cases,
we're also seeing a rise in the number of quarantines that are necessary to address the problem. And that applies to both students and to employees.
Continuing to follow DHEC recommendations, Horry County Schools has several new updates as of yesterday on COVID policies. The board says the 2 major changes include if 20% or more of a group of students within a class are absent or sent home early for testing positive, the entire class must quarantine unless they're fully vaccinated. Students can also now take and submit at-home COVID tests to provide proof of negative results. While these updates are being implemented, Superintendent Maxey says the Horry County School District is too large to create a blanket system for addressing the spread of COVID-19.
We're going to continue with our school operations. If we see that there is a location, whether it is a school or a classroom, we will look at it on a case-by-case basis and make decisions regarding operations of that classrooms, or school based on the information that we receive from the administrators.
Dr. Maxey says one of the most important things that they can do is try and keep as many students in-person learning as possible. The second semester starts on January 18th.
Yeah, Jay, well, for folks at home needing those results to find out if they do have the virus or not, it's critical. And it can impact someone's job schedule, or it impacts their kid's ability to go to class during the week. Now, if your priority right now at home is to find a rapid test, either for at-home use or by appointment, they're going to be hard to come by.
We had a lot of test demand during those last waves. This one is even more.
And if you want to get help at rapid test providers like Conway Medical Center, they won't be able to help you until next week.
My understanding is it is Tuesday is our next available time, meaning we would be booked for today and for Monday.
But waiting is not an option for families like Ashlyn Prose.
I definitely wanted to know before sending my daughter to school today whether the first test was positive or not.
To even get a test for her family was not easy. Pro tells me she went to 3 stores, including her main pharmacy. No one had home COVID tests.
It's impossible to find. I mean, finding one test is a nightmare, but there's a total of 5 people in my family. We have 3 kids. And so that was a challenge in itself.
Fortunately, she did find one, but they still plan to get a more thorough test done over the weekend. For those looking for the PCR over rapid tests, lines are shorter at some locations like this one in Conway compared to earlier in the week. And I went to 6 different stores that carried the at-home tests. Only one store had a test in stock. DHEC claims help is on the way.
We recently bought 500,000 at-home tests that we're going to be distributing.
That's on top of the federal promise for tests as well, all with an unknown time frame, when time is of the essence.
Best thing is to not need them at the point where you have to go to 4 different stores and deal with, 4 different pharmacies.
Some advice there from Ashlyn Pro. Now, she told me they try to be proactive in all of this. They actually ordered some at-home tests roughly a week ago. But she says right now she doesn't even have shipping information for those tests yet, where they may be or not. Now, online, Abbott, one of the test developers, they actually have a list of locations that you can try to look up if they have a test in stock. I have that information for you, all new on this story, over on WPDE.com.
Yeah, health leaders say masks are so important in schools right now because there's a 176% increase from last week in South Carolina children hospitalized for COVID-19. They say they're concerned for the coming weeks because the Omicron variant seems to infect a younger population.
With students returning to school this week, I'm very concerned that we may see a spike in pediatric cases.
South Carolina epidemiologist Dr. Linda Bell's concern comes as 39 children are battling COVID-19 in hospitals across the state.
There are only 8% of children ages 5 through 11 who are fully vaccinated. The younger people are exposing older people who are at higher risk for complications.
The state health agency's director does not want kids out of school, though.
We want to keep children in the school because we know that that is a much better learning environment, that there are better outcomes for our students from the educational and socialization standpoint.
Dr. Bell says wearing a mask at school is one of the best ways to do that.
The sound science-based recommendations for how we prevent people from being exposed to how this virus is spread are not being followed. We should start there.
It's a choice parents will have to make, though. State lawmakers have banned schools from requiring masks through a budget proviso. Now, a federal judge did rule in September that schools have the individual right to mandate them. Governor Henry McMaster and Attorney General Alan Wilson appealed that ruling, and while they're waiting for a decision, the governor made his stance clear yesterday.
We're not going to close schools. We haven't, and we will not close the businesses. We will not impose mandates for face masks, vaccines, or anything else.
For now, the health agency says they strongly recommend you have your child wear one at school. Now, I reached out to the 2 South Carolina lawmakers who have the power to bring back discussions on masks in schools, and I asked if they believe that they should have brought that discussion back before this current surge or before the federal judge's ruling. I have not received a response.